Known as the National Health Service, it has been plagued with problems since its inception. So should the U.S. follow suit? Well, I asked a member of the European Parliament, Daniel Hannan. You have tried on a couple of occasions to warn America, and you describe us as a friend, as an ally, a supporter. You're fond of America. You know American history. Let's start with a broad overview, and then I want to get into the specifics. Why do you warn Americans that nationalized health care is a nightmare, as we're calling it?
Well, I'm already living in that system. I'm the man from your future who can see how it isn't working. And the clearest proof of that is to compare which country you'd rather get ill in statistically. I mean, this isn't an opinion thing. There's empirical data on this. You know, if you get prostate cancer, you are about 4 times as likely to survive in the US as you are in Britain. Breast cancer, the same thing. Stroke, heart disease, surgery, your survival rates are way, way better. And that shouldn't surprise anyone. I mean, we have a system that is run along Marxist principles, funded out of general taxation, contribution according to ability, distribution according to need, and like everything else in the communist system, it doesn't produce efficient outcomes. When you have something that is free, it's abused. And it's abused not just in that sense, it's abused in a much more insidious way, which is that there is absolutely no attempt to make efficiency savings, either from the point of view of the person prescribing or from the point of view of the patient. There's no incentive to get exactly the same treatment for less, because everything is free. And you know, we all know this. If you and I were in a restaurant and we knew that somebody else was paying, we would be less, you know, our attitude to what we were ordering would be different, not because it would necessarily make us any better off, you know. And you know, when I say this, like I say, there was a big row when I said these things on your program before, and people will say, oh, how dare you even talk about money in the same sentence as healthcare? You know, we're talking about such a precious thing. But of course the answer is there are limited resources in this world, and if they are not spent carefully, then there is less to go around for everybody else, and there is a lower quality of healthcare overall. And the best way to allocate resources efficiently is through consumer choice. We know that in every other field of human activity. You know, but the one thing I would really say to you is, once you get a system like this, it becomes almost irremovable. You know, we have 1.4 million people, as I say, working in the system. It's a massive electoral bloc of people who really refuse to contemplate any change. And my understanding, I'm not an expert on this, but my understanding is that Canada, when they started going down this road, did it in much the way that is being proposed in the US, that they said, well, there'll be a sort of state option alongside the private ones. But of course, pretty soon, that drives out all of the alternatives.
Yes,
and the logic of the argument means that you end up where they now are in Canada, where there effectively is no private alternative. And that's where we are in Britain. And let me tell you, you don't want to be there.
I appreciate the admonition, the warning, and I got to tell you, what you're describing, Daniel, is a nightmare. I hope Americans will listen to a friend and a great warning. Appreciate it as always. Thank you for being with us, sir. And by the way, tell everybody at the National Health Service I'm glad they're watching. And coming up, doctor shortages are just one problem of a national health care system and what it would create. You're going to hear from the medical student who confronted